Hello, welcome to our show today, Community Wellness with Pat Simpson. I'm a nurse at MGH. I do emergency preparedness for Revere, Chelsea, and Charlestown. And we have a show that we discuss health and wellness and safety and emergency preparedness. So we are so happy to be back after this crazy winter. Happy spring, by the way. The flowers and the beautiful weather outside. It's such a relief, and we can all get out now and walk and be together and do fun things as we get healthier during the spring, summer months. So thank you for joining us today, and we have a special guest today, a friend of mine as well as a colleague, and she's one of my very special people in my life. Her name is Joanne Rowley. She is a clinical nurse specialist for MGH Revere in Charlestown, and she does a lot of great work in the community as well. So welcome, Joanne. Thank you so much for coming.
Thank you, Pat. I'm delighted to be here.
Thank you. Well, let's just jump right into it. Let's see, can you tell me what what the Wellness Center is, and tell me about what your job is at here?
Oh, big question.
Yeah, big question. So
first, I just want to say how happy I am to be here and to share what this work is about at the Wellness Center, and it's something I'm passionate about, and it's something that I know has touched the lives of a lot of people. So we're very honored that we exist within MGH Revere Healthcare Center, for sure.
Wonderful.
So the Wellness Center, it's actually located on the 5th floor of MGH Revere Healthcare Center, and straight up on the elevator. And one of the beauties about that is that our offices and our treatment rooms and our activity rooms overlook Revere Beach. So I find that when patients walk into the setting, they automatically exhale and experience a sense of ease and relaxation, which is at the root of a lot of healing. Then on top of that, there's a lot of different things that we offer and provide. But first, let me say, I think the Wellness Center itself was birthed approximately 12 years ago. So it's somewhat new and yet quite developed and well entrenched within our healthcare system. And it started through the vision of, I think, a key woman who was the executive director, Ann Richmond. And she worked very hard, diligently with other community health associates members to manifest this vision, which they did successfully. And we work in close collaboration with the primary care center, the nurses and the doctors, as well as some of the specialty groups, physical therapists, for example, and also with the mental health department, and provide an array of services that I'm happy to speak about.
Excellent, yes.
I wish I could say, I don't know off the top of my head how many participants. If I was better prepared, I'd have that number, and you'd be very impressed.
Well, there's a lot.
It is a lot, and it has grown. And people find out about us either through their doctor or nurse, or they self-refer or from a friend themselves. Everyone does need to have an MGH provider, so that is a partnership for our particular services. The model that we offer is unique, but I think it is important to say, and you and I were talking about this a little bit before, that a variety of these services are available out in the community in other settings, if by chance someone in the audience does not have an MGH provider.
Exactly.
Just to keep these things in mind. The tools and the services that we provide really come out of the complementary medicine and integrative therapies. These are therapies that really support someone's healing and or address symptoms like pain. A significant portion of our population comes to us for pain and pain management. We provide, let me give you a little bit of the menu, acupuncture, massage, those are our key individual services. At different points during our operation, we've provided individual consultation, stress management services. Then we also have movement programs. We call them mindful movement programs, a Tai Chi based program and a yoga based program, and I'll say a little bit more about that. And then we also have specialty groups. A number of the specialty groups are run in collaboration with another department. The mental health department is a key collaborator where we provide various different mind-body oriented groups, and some of our groups are run in affiliation with the Herbert Benson Institute, which is now based out of Mass General Hospital. Herbert Benson and the relaxation response kind of go hand in hand. And if there's interest, I can say a little bit more about that.
Excellent.
But we also have specialty groups for sleep, All Be Well, Living Well with Chronic Pain, and then groups and programs that are across the spectrum. And I love this part, that here at the health center, and particularly with this wellness center, that we provide services for the range within the adult population. So the prenatal pregnant moms might come and have massage with one of our certified trained massage therapists in prenatal massage.
How nice.
They might participate in prenatal yoga. They might participate in mindful parenting classes. And then over on the other spectrum, we have a very successful program called a senior wellness program for the 60 plus, for a lot of us, right?
Yes.
And in that program, we offer movement programs as well as meetings twice a month that are educational or social or inspirational.
And
it's
fun.
I've
come to some of them, and thank you for having me be part of them, because what a great group.
It's a great group of people.
Oh my gosh.
It's a great group.
So much fun.
It's a great group. You know, many of them, there's one gentleman in particular who has networked out into the community, and then he is involved in a tutoring program, and he's enlisted some of the other members into some volunteer work tutoring with young children. It's been a very rich and rewarding program.
Beautiful. Real community outreach.
Real community outreach. Yeah, real community outreach. You know, we serve adults, so 18, and I think the oldest member that I'm aware of is 98.
Wow.
And she just had her 98th birthday, and we got to celebrate that with her. She's actually quite inspirational. She attends all our movement groups and is very active, and actually complains about how busy she is, and she has to let go of some of her memberships here and there. But wellness shines through her. Yeah.
Absolutely. Wonderful.
Yeah.
And what is one of your favorite, so what are things that you teach, that you do personally?
I'm involved with the movement programs, and I'm involved with the specialty groups. The movement programs, which I dearly love, I'm a certified yoga teacher of maybe 30 years at this point. It's hard to keep track of the years as they do go on.
Yes.
Fortunate. And the yoga class that I'm offering now is a chair and standing yoga. It's a very gentle practice. There's a lot of yoga out in the community, so there's a lot of ways that people could take advantage of yoga. Yes. What I find in this class, and the class size ranges from 8 to maybe 20, it's a very robust group, and I have to say, not unlike entering the wellness center and experiencing the Vista, coming into this group is such a heartwarming group. Some people know each other, but majority of the men and women are strangers, but there's an endearing quality to it. A number of people come also to begin with because they feel comfortable, because I'm a nurse teaching yoga, and they feel safe with that.
Yes.
And the practice is geared, half the session is in a chair. Some people, because of mobility issues, stay in the chair and they continue with the practice, and then the others continue with the standing practice. And what they report, and the intention is great joint health, spinal flexibility, muscular strength, as well as, because it's yoga, we're doing the movement with the breath. So they learn to breathe more effectively, they learn how to use breathing practices for stress management, for sleep enhancement, and then we close with a little relaxation, kind of a relaxation meditation. Wow. I've had wonderful reports from people. There was one woman who was diligent in her attendance, as well as she participated in the other specialty groups. So she really took advantage of the wellness center. And when she first came, she was on the transplant list for a new lung, and always had her oxygen with her. And over the course of that year, she was no longer carrying the oxygen with her.
Wow.
And was pausing about the need for the transplant. She had done so much to help serve her health and well-being, to slow down the disease process that she was looking at.
It's so amazing how many resources and how much is out there. And as nurses and doctors and working in a health center, we need medicine, we need interventions, we need the surgery sometimes. But sometimes you can actually, like you're just saying, the example of doing other things, alternative things that could support you to be healthier and could possibly get you off medication and prevent surgery, etc.
Yeah.
So it is so fabulous. It's just, it's
very
almost
relevant.
mind-boggling how wonderful it is and how it's there for people to use.
You know, I like the word complementary.
Complementary.
Because it's
Exactly.
about
Perfect.
the working with. It's not, doesn't have to be an either or.
Exactly.
It's a complementary. And
Exactly.
a lot of these modalities help support the body, the mind, and the spirit to heal most effectively, and often and usually in relation to these other approaches.
And they get socialization, and in many of these examples of their programs, there's so many other benefits that they get from besides the modality. It's so much
Exactly.
else, and feeling like they're part of a group,
part of something.
which we all want to be part of a group. It's wonderful.
Yeah, there's a way they help take ownership of the wellness center. You know, it's
Yeah.
our wellness center. It's my place. You know, the piece that you mentioned about the other courses of treatment, just to step into the acupuncture hat. I'm not an acupuncturist,
Yes.
so we have an excellent master's prepared acupuncturist. And the highest percentage of people that come for acupuncture come because of pain associated. But there are other reasons people come for acupuncture. But we did do a survey once to see the results, and that particular survey showed that 71% of the people that were engaged in the acupuncture treatment reduced their medication as a result of acupuncture.
Wow. Well, I went to the acupuncturist there at MGH, and I was doing it pre-surgery. I was having meniscus surgery on my knee, and I had the acupuncture, and it helped with the pain so much, and my recovery seemed to have been much quicker than other people's because I think of the acupuncture. So it's
That's an
amazing
excellent
in so
story.
many. Yeah, it
There's
was.
so many
I was so
different
grateful
ways.
because I didn't want to take pain pills all day. I had to work. I was busy. I didn't want to be taking pain pills all day long, and it really it helped me to do that, to deal with the pain and and then increase my healing. It was wonderful.
Learning the relaxation breathing also is helpful with pain reduction.
Yes.
And also learning about working with one's thoughts. And that's something that's brought into when we run the program Living Well with Chronic Pain. We bring in a variety of different modalities in education that include educating people about acupuncture, like the vignette, the story that you just shared, as well as looking at what impact do my thoughts have, my beliefs have, basically on my stress and tension, and how that then affects our pain. And what impact can nutritional changes make on my pain? Humor, joy, positivity. These are some of the themes that are incorporated into the specialty groups. Before the other movement class is the Tai Chi class.
Yeah.
And that has been so much fun as well. The class that we offer there is based on Dr. Paul Lamb's Tai Chi for Arthritis. And it's a wonderful evidence base supported by the Arthritis Foundation to reduce symptoms. So, you know, at Mass General, we tend to gear towards things that have been proven by science to be effective, proven by research. So that's always nice to describe that, as well as what I hear from people is that it does impact the quality of their own sense of balance and their concentration.
Wow.
Because of the movement's very flowing and gentle, that it does call for paying attention.
Yes.
So we have a lot of fun with that one as well.
Now, how does this help you? This must be it's a nice side effect. You must get some positive side effects for your...
I do. Yeah, it hasn't been unusual. I can remember at one point when I had a meeting to discuss some important and some concerning issues with my director, and we began the conversation, and she said, "Well, why don't you talk with me after your Chi class?"
There you go.
Because she knew I would be more relaxed and more centered and more grounded, which I was, and my mind was clearer and approached the issue at hand more effectively. So you're right, it does.
And I've been in some of your classes, and you do the quick little mini ones, and it always, in the middle of the day when you're so busy at work, doing that just for 5, 10, 15 minutes, it's amazing.
It does make a difference.
So we actually have a little time. Do you think you could do a mini?
I'd love to.
That would be great.
I'd love to.
A little mini relaxation
little
that
mini.
our audience at home could
I would love
follow
to.
along, and they could also remember to
Experience
do
that.
this when they need to relax. Perfect.
Thank you for proposing that, because that actually, of the variety of our programs, these mini relaxations have been what we've gotten the most feedback. People learn a variety of different techniques and approaches and mind-body tools, but this mini is something that travels with you very readily. And what this mini means is that we're going to take just a few minutes and engage in a little relaxation exercise.
Perfect.
And what I'll do is I will lead you through a little body relaxation to release unnecessary physical tensions from the body. I will lead you through a little gentle breathing exercise and just a few moments of something that is like a meditation. And
Perfect.
just to notice how you feel. So those of you out there, please participate with me. And if you're uncertain and not game, just watch and enjoy yourself. So to participate, I invite you to sit upright. You may be in a cushy lounge chair, but see if you can sit, take a moment and adjust yourself to sit more at an upright position so that you can feel your feet on the floor. If you could place your feet about hip width apart, that would be great. You might notice that when you do that, you might feel a little more grounded, so that you can feel your heels and your big toe and your little toe. And then pressing right down into the buttocks, into those bones that we call the sits bones. To me, they're like the heels of the pelvis. It's like you're assuming your seat. And sometimes even just doing that helps me to feel more grounded, and I automatically breathe a little bit more deeply. And then I invite you, actually, to take a deeper, fuller breath in and a slow, easy breath out. Now, it may be that there's different thoughts and activities that go on in your mind, in your brain. How fortunate. But when and if that happens, just bring your attention back to my voice and where I'm directing you. Because now I invite you to lift up through the crown of your head, like there's an imaginary string there. And using that muscle of imagination, let's imagine that there's an invisible helper that lightly pulls on that string. And with that, we create more space up through the core of our body. Sitting upright like this automatically creates more space inside, and our muscles of respiration, our breathing muscles, can work easier. We can then breathe more deeply and steadily without effort. And that has a calming effect and a balancing effect on our nervous system. So we're grounded in the heels of our feet, our big toe, little toe, grounded down into the hips, lengthening up through the core of the body to the crown of your head. Now let your upper and lower teeth be separate. Let your jaw be released. Releasing unnecessary tension through the face and the neck, and actually even just letting that release through the upper and lower teeth will help release tension in the back of the neck. And now for a moment, as if you're lifting up through the armpits, let your shoulders come up towards your ears. And take a gentle inhale. And when you're ready to exhale, let the shoulders roll back and down. We're going to repeat that. Lifting up through the armpit space. Draw the shoulders up towards your ears. And then easily roll them back and down. Just letting the shoulders rest lightly on the rib cage. As the shoulders drop down to your elbows and your hands and wrists rest lightly in your lap, inviting the body to relax. And now, to the best that you can, sense and feel your own breathing. And that might be something that comes natural for you. Try not to think about it. Our breath is like a gentle wave. And I like to think of on the beach when the tide is way out far and the waves roll in slowly and they roll out slowly. Imagine that, like your breath, rolling in slowly, rolling out slowly. That inhale is a source of nourishment, energizes us, and the exhale calms us and releases tensions. And then just one moment longer. If your eyes are open, just soften them. And I invite you to choose a word or a phrase that's calming for you or anchoring. It could come from a faith tradition if you have one. Keep it simple. Or it could be a word like calm, peace. And in your own mind, repeat that word or phrase as you breathe, just for these few moments. Breathing in calm, breathing out peace. Breathing in calm, breathing out peace. Calm, peace. All is well. All is well. All is well. And now let yourself take a deeper, fuller breath in, like you're breathing in fresh morning air by the sea or some favorite place. Inviting a sense of this transition being an invitation to feeling more refreshed and renewed, hopeful and lighter in your body, in your mind, in your spirit. Sensing your feet on the floor, you might even wiggle your toes. Feeling your hands, you might even wiggle your fingers a little and shift your body. And just notice how you feel in your body, in your mind. And if we did a little check-in before, you could do a pre and a post. I'm glad that we got to do this together, even though I can't see you right now. But
Yeah, you know that people appreciate that because that's so important to take that time out. It feels so
I've had
good.
people speak about it's not unusual, maybe with all due respect, to have a long time waiting for their medical appointment. And one option is to get your blood pressure up if you get anxious and worked out, but another option is to do one of these minis while you're in the
Yes.
waiting room and keep your blood pressure, nice and low. And
But the mini could help with the blood pressure, with sleep, with stress,
yes,
with everything. So
Yes.
it's such a wonderful
Yes.
tool. Thank you
Yes.
so much
Oh, you're
for
welcome.
sharing that
You're
with
welcome.
us.
I'm glad you did it with me as
I know,
well. I could feel it.
I'm
Yeah.
ready to take a little nap. It's lovely. And it's spring, and now we'll have a spring in our step, and we
Right,
can
right.
be relaxing, and we
Right.
don't have the stress of the winter.
No.
So it's
What
a
winter?
good time right now, the long gone winter. Now, we only have we have 5 minutes left. Can you tell us a little bit about how people can be referred
Yes.
for this
Yes.
program? Because this is for MGH, but also there are things in the Y and other places have offered different
We have
alternative
great senior centers in
senior
our community, and the Y
centers.
programs, and
Yes.
even various health clubs have some reasonable rates.
Yes, so there are other options, but can you tell us a little bit about how an MGH patient would be referred?
Sure. Commonly, people are referred by their physician or their nurse or even
Okay.
their physical therapist.
Yeah.
However, people can also walk up to the 5th floor at the MGH Health Center into the Wellness Center and say, I'd like to know about the Wellness Center, I'd like to enroll. And what we do behind the scenes, it's very uncomplicated, is that we always contact the primary care provider because the doctor does need to provide medical clearance.
Excellent.
It's a very uncomplicated process. So it may be that this is something that an individual asks their doctor about. It's not unusual that the doctor or nurse might tell them, why don't you check out the Wellness Center and enroll in the Mind-Body course for stress management or the Sleep Out group, or have acupuncture, massage, or the movement for some of the reasons we've discussed.
Excellent.
It's very easy, and we aim to have it be easy.
Perfect.
There's also a phone number, 781-485-6400. 400, thank you.
And we'll
Yes.
put it up at the end of the
Oh,
program
great.
also, so people can call that
Great.
number.
For those folks who have an MGH provider,
Yes.
those services are very accessible, and we invite it. We so invite it. We aim to serve.
Wonderful, wonderful. It's such a great program. It's such
Yes.
such a gift to the community, a gift to the patients, and a gift to the staff. And it's such a nice support for the doctors and nurses to have their patients get alternative therapies besides medicine and surgery and invasive procedures, which are needed. And thank goodness we have the ability to use those resources, but to have this alternative possibilities.
We've been so thrilled to be able to provide this, and we have our established programs, but also just
Right.
to say it's not unusual that we might collaborate with some of the other departments.
Yes.
Because nowadays there's a movement towards the medical home and the group visits, so we might bring in a teaching module within the service and offer our services in different manners.
We're so lucky at MGH to have all the different experts in all the different
We really
topics
are.
that we can use them also for resources and collaborate with each other, which is such a wonderful model.
You know, you did mention also how lucky we are as staff to have this, and I have to
Yes.
say that the Wellness Center has been committed also to providing some self-care services for the staff.
Which we
Because
very
the
much
staff
appreciate.
needs it too, so
Yes.
that at different points during the year we provide free acupuncture and massage and relaxation techniques so that we're taking care of our own as well.
Yeah, it's just, we're very lucky. It's very nice. Oh, excellent. Well, we have like 1 minute left. Is there something that you'd like to
heavens,
wrap up? I know I feel like we could talk all day, like we just got started, but
Call us, come by,
Yeah.
inquire, try something. And certainly the services are things that you can try, and I really encourage people to come try a movement class.
yes.
Can't say enough about movement, how we need to keep moving. Of course, I always think of, whether it would have been my father who always say, you have to move it or you're going to lose it, right?
It's true, and they say that's true with muscle tone and everything, right?
And
in
taking
your
a walk
brain.
around the block and how much that helps our
Yes.
mood.
Yes.
Yeah.
And now that the weather's nicer, people can get out.
Yes. Walk
and
the beach.
Walk the beach.
Come over
and-
to 300 Ocean Avenue and check us out.
Exactly.
Yeah.
Oh,
Thank
thank
you so much, Pat.
Joanne. You are so wonderful. Thank you. You're such a gift to all of us, and I enjoy your classes. We're so lucky to have you at MGH, and the Revere community so lucky to have you. And you're so calming, and you're so knowledgeable about all your wonderful gifts that you offer us. So thank you so much.
You're very welcome.
Thank you for joining us today for Community Wellness with Pat Simpson. It's been great. We are looking forward to another show. We have some really fun topics lined up for the future. So thanks again, and happy spring, and stay healthy and relax. Thank you. Take care.